families are the foundation of our society, then it only makes sense to make them as strong and healthy as possible. One of the best ways we know to accomplish this goal is to give every new child coming into the world the best start he or she can have. Public Health's mission is to prevent illness and promote well-being. Prenatal care fits this mission perfectly. Prenatal care refers to the health services a pregnant woman receives before a baby's birth. Healthcare providers know prenatal care is important because potential problems which may endanger the mother or her baby may be discovered and treated prior to birth. In many cases, potential problems can be prevented altogether. Because of this, it is important that a pregnant woman not only begins prenatal care early, but also receives continuous care throughout her pregnancy. Babies born to mothers who receive no prenatal care are 3 times more likely to be born at low birth weight and 5 times more likely to die than those whose mothers received prenatal care.
Prenatal care is making sure that mom is healthy enough to have a baby to begin with, okay? Prenatal care starts before you get pregnant because you should be on folic acid, you should be preparing your body for that pregnancy, you should have enough time between the previous birth for your body to adjust and be healthy.
Many times what a woman does to her body the 3 months beforehand actually can affect the baby, such as folic acid. A lot of times women don't take folic acid until they become pregnant. It's really important that they have that before pregnancy so that when they do become pregnant, those first early days and weeks before they even know that they're pregnant, that folic acid is able to help them.
The reality is that with prenatal care, you have somebody who's looking and watching, and it's consistent, and it makes a difference in outcomes. We have found in the Baby Steps program that we case manage our mothers. So what that means is when we case manage them, we ensure that they're going to all of their appointments, and we tear down any barriers that they have that will prevent them from getting to all of their appointments. So they're getting consistent prenatal care. And what our birth outcomes are so great with case managing them that we have less than 5% admissions to the NICU, which is incredible. That is an incredible rate. It is absolutely what you want to happen when you're talking about prenatal care.
Following what appear to be perfectly normal pregnancies, complications during birth will occur about 10% of the time, even with comprehensive prenatal care. And for those who think our great-grandmothers may not have needed prenatal care and they did all right, remember, that really wasn't the case. Stillbirths, miscarriages, infant mortality, and deaths of both mother and child during childbirth were a lot more common way back when. The purpose of modern prenatal care is to make pregnancy and delivery as healthy and uneventful as possible, and to result in both a strong, healthy mother and an equally strong, healthy baby.
I don't think that some of the people really understand how many women are not getting the prenatal care. There are a lot of women out there that just don't have the opportunity to go see a doctor and to make sure everything's okay. Back in 1963, our infant mortality rate was a lot higher. And over the last 40 years, we've done a very good job of getting that infant mortality rate down. Just recently, it's gone back up again. And so I think that it's time for us to all look at that issue and say, why and what can we do? And I think prenatal care is a great place to start looking.
When you don't have prenatal care and you end up delivering in a hospital, a physician is delivering you not knowing anything about your health history. They're just taking it as it comes.
We rank about 44 in preterm births. The latest statistics that have come out shows that every week, in an average week in Nevada, we have 113 preterm babies. And the reason for the preterm births are various. We do have a very low prenatal care rate. We have a very high C-section rate, so there's a variety of reasons that these babies are coming into the world early.
Michelle has touched on 2 very important elements of the prenatal issue here in Southern Nevada: our high rate of preterm babies and our low rate of prenatal care. Preemies, as they're known, start their lives fighting an uphill battle, usually requiring extraordinary and expensive medical intervention for just their immediate survival. Many will suffer permanent disabilities or medical challenges they and their families are going to have to deal with for the rest of their lives. Our low rate of prenatal care is truly a tragedy because it should be preventable. Prenatal care involves 2 patients, the mother and the baby. Women in Southern Nevada are just as committed to nurturing and ensuring the best possible opportunities for the children they bear. It's not that they don't care for many, it's that they don't have access to adequate prenatal services.
We see a larger number of people who are seeking services, but we're seeing them from different walks of life than we used to. Now we're seeing the folks with that have been in a different economic circumstance, maybe a year or so ago, who their life is not the way it used to be, and who are having to navigate and access resources that they never have had to navigate before. So we're seeing a little bit different clientele, and we're also seeing clientele who are on harder times than they were before.
I think for some, there's a lack of education. Some moms think that it's not necessary to go the first 3 months, that they'll show up in the second trimester. But I think for a lot of people, it's insurance and a lack of ability to pay for it.
Unfortunately, especially with very young gals who are perhaps not as obsessive at tracking their menstrual cycles as the older generations were, this may mean by the time they come in and get verification that they are pregnant, they are already into about their 4th month. There are a lot of providers in town that are no longer willing to see them because, combined with their youth and the late entry into prenatal care, they are now considered high risk.
We've established that comprehensive prenatal care actually begins before conception. It certainly includes all 40 weeks of pregnancy. But if access to care is limited or delayed, both doctors and patients are starting out at a disadvantage. If prenatal care is denied completely, it usually means the first time the mother has seen a doctor is when she arrives at the hospital to deliver, with no medical history and no prenatal history. Everyone involved finds themselves in what could easily develop into a full-blown emergency situation. So if a pregnant woman has no insurance and doesn't have the income to pay up front for prenatal services, as many providers require, what are our current options in Southern Nevada?
They can apply for Medicaid. There are some agencies and organizations that will offer reduced prenatal care or a no-pay prenatal care, but because of the recession, those programs are also getting stretched, and so they're few and far between. One of the programs the March at Dimes is promoting is Centering Pregnancy, which is a group prenatal care program, and it's really been not only cost-effective for the doctors and organizations, but it's also shown to reduce preterm birth rate from 30 to 40%.
Another resource is the Baby Steps program at UMC's Family Resource Center.
They get to see a registered nurse who does a health history on them, and we determine any risks that they might have, and we ensure that they get referred to a provider who is appropriate to care for them. If they're low risk, they could see possibly a certified nurse midwife or a family practice provider. If they're high risk, we make sure that we get them to somebody who can take care of their high risk needs. They see a financial eligibility counselor who will determine whether or not they qualify for Medicaid or any other programs that might be out in the state. And if they do, we will make sure that we apply for them and that we see that application through to fruition so that it gets approved.
Lisa referred to the Medicaid program for pregnant women who qualify, but that may not be the safety net you think. Here with that part of the story is the district's Stephanie Bethel.